I can only blame the lockdown and the shutdowns of medical practices that are, quote, deemed non-essential. But darn if they aren't essential for these patients. I'm Dr. Alina Sholar. I'm a plastic surgeon, and this is my second opinion. Hi, I'm Dr. Alina Sholar. I'm a plastic surgeon in private practice, but I'm also the owner and CEO of a multi-location physical therapy and PMNR clinic and regenerative medicine clinic in San Antonio and Austin, Texas. We have a patient here in the clinic who postoperatively, after orthopedic surgery, had a new onset seizure. However, she has been unable to access neurology care for the seizure due to the shutdowns of medical practices. Well, she's faced with so many what ifs right now due to the uncertainty of what the cause could be. What if she has a brain tumor? What if she has MS? What if she has had a vascular event and we just don't know? To further the collateral damage, though, with her, she can't drive until the seizure workup is completed. So she has missed all of her physical therapy appointments for the orthopedic surgery. It could be devastating for her, and we hope and pray that it won't be. But if it is, I can only blame the lockdown and the shutdowns of medical practices that are, quote, deemed non-essential. But darn if they aren't essential for these patients. And she's just one example of how our patients are getting tossed aside right now by bureaucrats focused on the virus, with a total lack of consideration for the future care and the future health of everyone else. My aesthetics practice has nearly been non-existent during the lockdowns. And so it's been a major financial hit. And my staff, of course, are worried for their jobs. And there's the worry and the angst and the depression that goes along with that for them. And of course, for myself, too. And then for the physical therapy clinics, we've seen a really critical level of non-compliance and no-shows, even though we have been open for appointments. But people are just terrified of this virus. And it's the media that's driven so much of this fear into the lives of our patients. And, they believe what they see on TV. And unfortunately, they believe the clickbait on social media. And it's really what's driving public opinion, and unfortunately, public policy as well. Not the science, not the scientific community, not the medical community. And if there's a shred of science, sometimes even introduced into these sensational stories, it's typically a tidbit that's self-serving and promotes the self-interest of the media outlet and not the scientific community consensus. So personally, I implore physicians to put themselves out there with solid information people need. For instance, I've had so many people confused about which curves to look at. They're looking at cumulative curves instead of epidemiology curves. So we've got to get out there and do our parts to properly inform the public.